Hello,
over.
everyone. This is Cole from the American Journal of Healthcare Strategy. I'm joined tonight with Ashley. She's currently an administrative fellow at MD Anderson. Ashley, please introduce yourself for us.
Yes, hello everyone. My name is Ashley Sekul. I'm a current administrative fellow at MD Anderson, originally from Pensacola, Florida, headed over to the University of Mississippi where I received my undergraduate degree in biochemistry, then went on up to Washington, D.C. where I pursued my MHA.
It's a great journey kind of across the states there. What led you to go to Mississippi?
Yeah, so actually, I have a lot of family from Mississippi. And so when I started touring colleges, I really wanted a small town feel. I'm from originally a small town actually next to Pensacola. So once I toured Ole Miss, I was like, this is just a place that feels like this town where I can get to know everyone and then also not feel overwhelmed by it. So it was just a really good decision to, start out away from home far enough to where you could meet new people, but then also be in a setting that was small and welcoming and really friendly.
That's excellent. I've heard a lot of students like that smaller but
Yeah.
still welcoming environment. I was talking to some at University of Alabama, and they said a similar thing. People don't always think of Alabama; they don't always think of Mississippi or Louisiana, but some of those institutions are really nice. I've heard.
Yeah.
And then after that, you chose to go into George Washington University, which is extremely well-known MHA program. Did you go there for the location, or is that because of how good their MHA program is?
Yeah, so I actually mainly went for the location. I really wanted to be somewhere that had a large city. So I got a little bit tired of being in a small town. And I thought, wow, how cool would that be to be in the capital of our country? And then also thinking about health administration, I wasn't fully focused on going into a hospital. So I thought, where could I get the most experience and the most opportunity? And when you're in DC, you have consulting, you have policy, you have insurance, and you have CMS and things like that. So I just felt like it would give me the broadest scope of experience so I could really hone in on what I wanted to end up doing.
And you had a lot of different experiences while you were there, I assume, but one of the ones that I noticed on your resume was the communications intern was in Washington, D.C., right?
Yeah, so I actually did two communications internships in DC. One was originally with the health IT company. And so that was really interesting, just getting to learn more about that space. Definitely something that was technically challenging and a lot of new buzzwords to learn. But then my second one was with an organization called PCORI. And so it's the Patient Centered Outcomes Research Institute. And I absolutely loved that internship. It was so interesting to understand how we are centering our research around patients and not necessarily just focusing on one hospital at a time, but maybe a consortium of hospitals getting together to focus on the same research project, or even how to disseminate, let's say, stroke information throughout Chicago. And so throughout that, I was able to interview some of these awardees who receive these grants to do research and just ask them, what's the heart behind these projects and how have you really impacted patients? And so I learned how to basically take their stories and put them into a blog and was able to get some of those published through Picori. So it was a really great experience.
That sounds like an amazing experience. That's incredible. Good for you. And then, so I guess what I'm wondering too is in between your undergrad and your graduate, degree, what was the kind of mental process that was going through your mind going from biochemistry to healthcare administration? When did you know you wanted to go into healthcare administration? How early on was that?
Yeah, so I was pretty much pre-med all the way through. I actually graduated undergrad and continued to look towards pursuing medical school and began to work as a scribe, actually for a radiation oncologist in Dallas, Texas. And so throughout that year, as I was learning more about healthcare in general and what it would mean to be a physician, I started to just see that maybe this wasn't the path for me, that perhaps this wasn't the place I needed to be. I still realized I needed to be in healthcare. It was definitely something that's always been at the core of my mission. I really love to obviously help people, but then also to work in a setting where you're surrounded by people who are driven by a mission of helping those who are sick. And so with that, I just really started to understand that maybe being a physician wasn't for me. And so I decided to apply to grad school and look towards the administrative side of things. And plus, when I was an undergrad, I actually was a biochem major, but a journalism minor. And so I always just had this part of me that liked not just science. Like there was something more there. Was it going to be communications? Was it going to be, maybe finance or just something outside of science? And I felt so focused in on science if I chose to be a physician. And so I moved into health admin to really expand on some of my interests and be able to couple the two. So that was pretty much the transition. But yes, it definitely took some understanding of working in the field of healthcare and being a scribe and being in that clinical setting to really understand that administration was the path for me.
I noticed you were a scribe. It says for about 10 months, so right up until you started. But how long did it take during that scribing program? How many months in? For me, I was a medical assistant for 6 months when I realized I'm not going to do this. These doctors are more incredible than I had even thought, but I'm not that incredible, so I'm not going to do, I'm not going to do this. I was working in neuroscience or neurology, so I was meeting MD, PhD
Yeah.
research. It was an incredible environment to be in, but it just, wasn't exactly the way that I wanted to go. But it was about that 6 month period when I realized I want to be in healthcare, but something else. How long did it take you?
So it was actually only about 3 months of
Okay.
working as a scribe. And I think a lot of that had to do with I was working for a physician who was a female. And so just hearing some more of like the work life balance side of things, I started to worry, what will this look like for me? Am I someone who necessarily wants to dedicate my 20s to going to med school and, focus my family around being a physician? Whereas I could have choose to be in healthcare and to really expand my knowledge and interests and still be able to have more of a work-life balance.
Excellent. That's so nice that you were able to meet with someone who was a female as well. I know it's been challenging for students who, whether it's a cultural, gender, racial boundary, they can't find someone who comes from the same background or has the same thinking process. So it's nice to hear, how important that is for our students. So then after, you go to DC and then you go back to Texas at one point for a graduate administrative internship. What is the connection you have to Texas? Because that's come up a few times. So what do you like about Texas?
Right. That's so interesting because I originally loved Dallas because I have an aunt there. And so we would go visit her during college. And I thought it was so cool. Like I said, I was in a small town in college. And so Dallas was super appealing. And so then when I started applying for internships, or actually, I guess when I applied to be a scribe, I received a job offer in Dallas and I was said, immediately, yes, I need to go live there. And then actually, when I applied for internships, I wasn't necessarily geared towards ending up in Texas again. It was one of those moments where it just worked out. And so I got to head back to Dallas, was able to actually stay with my aunt, which was super great and work at UT Southwestern there. And it was just something that I thought, okay, this has been my Texas journey. I likely won't be back. And then began applying to fellowships. And sure enough, I received an offer in Houston and couldn't pass it up. So I say Texas pulls me back. It's not me.
It
Texas
really
keeps,
does. It's very
it keeps
interesting.
taking me back. So I'm not mad about it. It's great down here.
I mean, those are some great institutions you've worked for too in Texas. Where did you work? Okay, I see it's on Presbyterian Cancer
Yeah.
Center was the
Mhm.
scribe. Nice. So you've worked for the great institutions of Texas when you've been there. And so then you come back to DC, and this is, I guess, kind of that fellowship with Levitt Partners or internship. It was a
It's a
fellowship
fellowship.
essentially.
Mhm.
And then this is that like quintessential Washington D.C. fellowship where you're working on policy. I want to hear more about that because that's an area that really interests me.
Yes, no, it was super fascinating. I honestly have to say I didn't know anything about the health policy space besides what I had learned in class. And so I was just thrown into it. And it was so cool because they have so many, just in depth projects. And so you learn so much more than you're going to learn in class. Obviously, in class, you're going to learn about CMS or Medicare, Medicaid, things like that. Whereas working for a health policy firm, you're going to learn about what clients are looking at, what policies changing. And so within that internship, I mainly focused on 340B drug impacts. So basically, how does that program impact drug pricing overall? Was able to help with the research on a white paper. And then some of the other smaller projects or more day to day work was focused on attending hearings and summarizing them and just really understanding what's going on each day in Congress and then keeping up with just everything going on day to day in the Senate side or the House side of things, and within each of the committees. So you just get really invested in what's going on, and it's really cool because it was 10 minutes from my house. So I'm like, this is such a unique opportunity, and one that really made me love policy. And I'm just really interested in the governmental relations space still, and love to keep up with that.
And so that's something that I guess we will talk about in a little bit on how you're thinking of doing that, because that's an area that actually interests me a lot. And I'd also like to see maybe later in our conversation how you're, going to be melding that into your career, because I'm very interested in policy as well. So your two internships in that, fellowship in, and then you do another internship in engagement awards. What led you to do that? Because I mean, this is a good amount of experience you're gathering through all of this.
Yes. So the engagement awards one was a really great opportunity just to understand more of how, healthcare is impacted on a large scale. So that's kind of how I felt about the policy internship as well. I felt like at this point, I knew I was going to work for a hospital, and I knew I'd be focusing on one area, one population, whereas I wanted to get one more experience where I could really see what's happening, nationwide. How is healthcare being impacted on a large scale? And so within that engagement awards internship, I was really able to meet with different the grant awardees, understand how they received their funding, what was the heart behind that funding, see some of the materials they created to engage their populations. And a lot of it was just dissemination efforts. So I worked with one group that did mental health research for graduate students, actually, which was really interesting, and another group that did mental health research with elderly adults. And so just really understanding how is this changing throughout our nation, not necessarily being led by a hospital, but being led by healthcare organizations. And so getting to interview and, speak to people who have a heart for helping people, but not necessarily in that hospital setting was super interesting.
It sounds like it's very
Yeah.
valuable to what you do now too. One of the questions I ask a lot of fellows, especially those who have more extensive experience, kind of like yourself, why choose to do the fellowship? What made you want to do that?
Yeah, so I was really indifferent about fellowships whenever the applications came out, just because having seen different fields within healthcare, I was nervous I would have to narrow it down to one. But then I realized the fellowship's the exact opposite of that. If you choose to do a fellowship, you're going to get to experience so much within an organization that it's going to feel like you're getting to do a bunch of different internships. You're seeing so many different areas. You're not just committing yourself to operations or to strategy or to governmental relations, but within the structure of my fellowship, I'm able to do 6 different things in a day, or mainly focus on one project during one week and then focus on one in a completely different area. And I feel like that's the way my brain works best. And so it was almost a no-brainer to choose a fellowship because I could continue to be in this space where I was learning so much about so many different things at once.
It sounds like that was definitely what you wanted to do. From what I know of a lot of fellowships as well, you just get exposed to so many different things, and it kind of seems like that's been a pattern for you, as you like getting this knowledge in different areas. I think that's how important, I guess. Do you think that hunger for that knowledge has been to the success of your career?
Yeah, I feel like the hunger for knowledge is something that keeps me going each day because I know that if I am getting bored in one area, I can ask to get a project in another area, or I can ask to take on more. To whereas if I didn't really have this thirst to learn more, then I'm not sure I would be as adamant about going outside of the box of my current projects. And I feel like with each project I want to, do something different, or I'm going to ask to sit on that additional meeting, and the worst that can happen is you get a no. But it definitely keeps things more interesting, and it allows me to be exposed to more, and I hopefully think that it will help me to build my career out more, and then also to continue to just build myself as a leader.
Definitely, I think you're on a great path to being a leader already.
Thank you.
So, from what I've seen, so you have this hunger for knowledge. You like all these learning all these new things, and then you mentioned that your 12 months are going to be up in about 3-4 months or so, and then you're going to start this. What did you call it earlier?
A
The
concentration, yeah.
concentration. What? And you said you were choosing risk.
So, yes, I will likely choose the enterprise risk management department. And so, within that, we've discussed doing a project that looks at pharmaceutical pricing and then
Mhm.
also supply chain costs. And so, basically, understanding what external factors are impacting those and then building out a dashboard to understand how we can mitigate this risk, really keep an eye on the risk, and then also just work with our different stakeholders to make sure that we are putting all of their knowledge into one place and keeping our heads up on what's going on in the market of pharmaceutical and supply chain costs.
And that makes sense because that ties into your experience at Levitt Partners then.
Yes. So actually, my Levitt Partners experience pretty much inspired me to really like pharmaceutical pricing because I think another thing that I really enjoy beyond policy is just research. I
Mm.
love to, I mean, I guess that makes sense. I love to learn. So continuing to be able to build upon my drug pricing knowledge and to research how supply chain is being impacted, because I don't know anything about supply chain at all, I will admit. I
Mhm.
feel like it's just something that excites me because I'm going to get to learn more. I'm going to get to spend my days researching and then just compile all of this into a risk dashboard and then also hopefully build out a white paper on what we can really be looking at in each of these markets.
Good for you. And then that white paper, if it's public, if you do end up, publishing it, turning it into a research paper, what, how many papers will that have been? Because I think you've published a few different things, right? Quite a few different things.
Yes, so I have been published for a neuroscience paper that I actually did in undergrad for my honors college thesis. And then I had an article come out with PCORI and then also was on the research portion of the 340B paper. So, oh, and then we did a white paper in at the end of graduate school for a capstone. So I
Nice.
helped partner for that. And that was for CAMI, an accrediting board for MHA
Well, yep,
programs.
I'm familiar with them. Yeah.
Yes.
So, what's your take on publishing? I know some MHA students, they don't like it. It makes them nervous. It makes them uncomfortable. I think comparing it to like the New England Journal of Medicine, these really astute publications that are, really excellent. But what's your take on it for the healthcare administration space? That's what we're trying to do. Is we're trying to make it more accessible, make it a little bit easier for them to write, so they don't have to go through this like intense method section. But what's your, have you found it rewarding? Would you encourage others to do it?
Yeah, absolutely. I think if you have a heart for any type of research or writing, I think looking to get published is something that can be very rewarding. I also think it's really great to have your words out there. Beyond working in health administration, I'm also a writer just on the side. And I actually have my own blog to which I publish, and probably not many people read. But with that, I think it's always important that if you do have thoughts and things you want to put on paper, that could really benefit others or influence people, especially within the healthcare space. I think it's extremely important to go ahead and try to get published and to put your knowledge out into a space that is going to be accepting, and it's going to be really rewarding if you're able to get to that.
What's the name of your blog? We'd love to plug it here to get more people to go read it.
Well, it's actually funny. So it's called Stay a While. So I basically based it on the concept of we want things to be infinite and we want them to last forever. And so whenever you're reading my blog, I say you should stay a while because that's just our hopes in life is that people stay a while or that things will last forever, all of the good things. And so I really just use it to write motivational things and things that I learn along the way in life and just really tie it back into little stories that happen. And so definitely not healthcare related, but just a passion of mine to write on the side.
Definitely. I think everyone should check that out. I know, we're healthcare focused, but really what we want people to do is be successful in creating the impact that they want. And I actually already pulled it. I found it real quick right here. And so it does seem very, very motivational. So
Yes.
I think everyone should definitely go check that out. We'll link it in the LinkedIn post for this. And then, so you're also very involved. You have a lot of different things that you do. You're very involved. I know with the National Administrative Fellowship Network, you are a regional chair. So how have you managed, if you could provide us a tip, how, if you don't have any, that's fine. But how have you managed all these different interests and all, this big busy schedule? Are there any tips you have for individuals like myself who sometimes struggle with that?
Well, the main thing I attribute it to is being an extrovert. I feel like as long as there's some socialization going on in an aspect of my life, I'm willing to do it. And so That's one thing. But then also, as far as time management goes, I'm a huge planner. I love to plan my day out, keep a calendar, keep a OneNote, and really put everything down on paper. But yeah, I really just think that as long as you can find good people in whatever you're doing, it makes it way worth doing. So, with NAFN, it's really great because everyone we're working with is super invested in helping fellows and in collaborating. And then also at MD Anderson, the culture is amazing. It's like, what can I do? Who else can I be around? Who else can
Mm.
I network with? And so I really attribute all of my things that I love in life to really getting to connect with people. And so, as long as there's that people portion, I'm willing to go out, try a new hobby, or join another club, or to work with another group in health administration.
That is a beautiful, just a spirit that you have towards that. I think that's an excellent spot to leave off on as well. I think we'll have to have you back on another time to kind of expand, probably after you're done with your fellowship, to talk about your new role that I'm sure you're going to be getting, probably a very exciting role after your fellowship. So we'll have to have you on again, but I could not be more thankful for you spending this 20 minutes with us. I know you probably went through a lot of preparation, so I really do appreciate it, and I couldn't be more thankful.
Well, thank you so much for having me. This has been honestly so great. And I love getting to talk about, health administration and just getting to learn more about what's going on in healthcare. And so it's really awesome that you're getting to do these interviews and get to showcase each of the different fellows around the country. And so I'm excited to see some of their videos as well.
Yeah, we're working with the NAFN to try to bring more of people from there on. And I've loved talking to everyone. I haven't done a fellowship myself. I'm living vicariously through everyone because all these fellows have been amazing, and you're an excellent example of that. So thank you for sharing your knowledge with everyone.
Awesome. Well, thank you so much. This has been great.